Hey, my name is Megan. I'm going to be doing your motor exam today. Can you just tell me your name?
Eric.
Okay, where are you?
The hospital.
And who's the president?
Donald Trump.
Okay. So I'm just going to have you do a little bit of counting for me. I'm going to have you start at 7 and count by 7s, okay? Go ahead.
7, 14, 21,
Okay.
28.
That's good. So he's alert and oriented times 4. I'm going to check his skin, looking overall for rashes, any lesions. You're good. I'm going to check his temperature with the back of my hand. Okay. Check the skin texture. That's good. And for any tenting with the skin turner, I'm going to have you hold your fingers like this for me. I'm just checking for clubbing. And there's a space there, so if he has no clubbing, you're good. Sorry. Let me see your fingers again. I'm just going to check for capillary refill. Just go ahead and check that on your feet as well. Okay, and it's less than 3 seconds for all extremities. Let's see. So I'm looking at his face, making sure it's symmetrical and it is no rashes or lesions on his skin. I'm gonna feel your scalp. Do you have any pain or tenderness when I do that?
No.
I'm checking his hair, it's evenly distributed. Feel his lymph nodes back there. I'm gonna come down your jaw. And then right above the clavicle. Okay. Let's see. Can you shrug your shoulders for me? Okay, you go back there. And then go ahead and do it again against resistance. All right, good. Turn your head both ways. Perfect. And the other way. Okay. And then go ahead and turn it against my hand. All right. I'm gonna have you make some weird faces for me. Go ahead and raise your eyebrows. Stick out your tongue. Wiggle it side to side. Smile. Frown. Let's see. Puff up your cheeks. Okay. Act like you're gonna whistle. Okay. That's good there. So we'll assess his eyes. I'm looking at his eyebrows, eyelashes, pupils, iris, sclera. I'm gonna have you close your eyes real tight. Okay, go ahead and open them, and then just look up for me. I'm gonna pull down here. Okay, I'm gonna palpate around. You have any pain or tenderness?
No.
Okay. And just so I don't forget, I'm also gonna check the sensation on your face. Go ahead and close your eyes. Oh, this is what it feels like. It's a cotton ball. Sorry. All right. Just tell me when you feel it.
Yep. Yep. Yep.
Okay. So let's see. All right. So I'm gonna have you hold this out at arm's length and cover one eye for me, and just read the lowest line you can see. It doesn't have to be super low.
All right. Let's say 937,826.
Okay. Pretty good. 2025. Okay, and then the other eye.
Same thing, I guess. 937,826.
Okay. And that one's 2025 as well. Let's see. Okay. So I'm gonna shine this on the bridge of his nose. Just make sure that it reflects evenly. You're good. Sorry. I'm gonna put my hand here. Just check his. Make sure his eyes constrict, and check the other side, and it does, and then do this side. Okay, and then just go ahead and look at the wall, and then I'm going to bring this into your sight. Okay, perfect. All right, I'm going to have you, I'm going to hold this up, keep your head straight, and just follow this with your eyes, okay?
Okay.
All right. Don't move your head. There you go. Alright, let me go up and then down. Check the lid lag, okay. Let's see. Okay, we'll check your peripheral vision next. So we'll have you cover one eye, and I'm going to cover the same side. I'm going to wiggle my fingers. Just tell me when you can see them, okay?
I can see him. I can see him.
Okay.
I can see him. I can see him.
Okay, and let's do the other eye.
Yep. 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 Yeah.
Okay. And then I'm going to have you cover one eye again, and I'm going to hold this here, and then go ahead and uncover. Alright, and then just do the same thing on the other side. Go ahead. Uncover. Alright. Let's see. I think that was it for the eyes. So go ahead and check your ears. I'm going to inspect them, make sure there's no rashes or lesions. They look good. I'm going to palpate the front and the back. Same thing. Okay. So we're going to do the Weber test. This is just going to sit on the top of your head. You'll let me know if you're hearing it greater in one ear, if it sounds the same, okay?
Okay.
Sound the same, better in one ear or the
Sounds
other?
the same.
Okay. And then I'm going to put this behind your ear. Just let me know when you can't hear it anymore, and then I'll hold it in front of your ear and the same thing, okay?
Okay. Can't hear it anymore.
Okay.
Can't hear it anymore.
Alright. And his bone conduction, or his air conduction should be twice as long as his bone conduction. We'll do the same thing on the other ear. Oh. I'll keep holding it with this hand. That's too hard. Sorry.
Okay. Alright, so
Okay. Alright. Let's see. So I'm looking at his nose now, just making sure there's no openings there. Symmetrical. I'm checking for ridges. And then I'll use my pen light and look on the inside of your nose. Okay, looks good. And then I'm going to have you open and close your mouth, okay? Okay, and then go ahead and clench your jaw. Perfect. And we'll look. Let me just put some gloves on now. And we'll look inside your mouth. I'm checking his lips, making sure there's no cracks. Alright. Let's go ahead and look in your mouth. Okay. And go ahead and say ah.
ha.
Okay. And I was looking at his gums, his teeth. He doesn't have his tonsils. And then, oh, let's do the same thing. Hold on. And then I'm gonna grab your tongue with this gauze and just take a look at the side of your tongue, okay? Go ahead and stick it out. All right, I'm looking for any rashes or lesions. Looks good. Sorry. You want a sip of water?
Okay.
Okay. Okay. So next I'll feel your neck. And of course I'm inspecting his neck, making sure there's no rashes or lesions there. I'm just gonna feel his trachea here, make sure it's midline, and it is. Check for tracheal tug. And I'm gonna check your thyroid. So what I'm gonna have you do is take a sip of this water and don't swallow it. Just a little sip is fine. And then tilt your head one way, it doesn't matter. Oh, there we go. Okay, so I'm gonna press this way and then go ahead and swallow. Okay. And then we're gonna do the same thing on the other side.
Okay.
Alright, I'm gonna press here. Go ahead and swallow. Okay. Perfect. If I didn't miss anything. Okay. So we're gonna do your lungs and heart. I think I'm gonna. Can I have you take your shirt off actually? Okay. So, inspecting his skin, making sure it's intact. Can you swivel for me? Thank you. All right, and just checking his skin, making sure it's intact, and it is. And I'm gonna palpate in a Greek key pattern, just where I'll be listening. Does that hurt? No. Okay. And let me see. I'll go ahead and listen. Is break normal? Alright, and then I'm gonna have you swivel a little bit again. And I'm gonna feel back here in the Greek key pattern as well. Okay, any pain or tenderness there?
No.
Okay. Okay, I'm gonna set my hands here. Can you say 99?
99.
Okay, again.
99.
All right. Let me go ahead and listen. All right, and he sounds good, but if he didn't, I would have him, or I would test egophony, bronchophony, and whispered pectroloquy. And since I'm assessing his back right now, I'm gonna check for CVA tenderness. I'm gonna have you sit up just a little bit. I'm gonna put my hand here and just tell me if you feel any pain, okay?
Okay. Nope.
No?
Where's that?
Sorry.
That's all right. Nope.
Okay, perfect. I'm gonna come back. Let me think what I'm doing now. Alright. Okay, so next I'm gonna assess your heart. And I'm gonna listen at the 5 different spots. It's the aortic valve at the second intercostal space on the right side at the sternal border. Pulmonic valve at the second intercostal space on the left sternal border. Erb's point at the third intercostal space at the left sternal border. The tricuspid valve at the fourth intercostal space at the left sternal border, and the mitral valve at the fifth intercostal space at the midclavicular line. I'm listening for S1 and S2. S1 is going to be the closure of the atrioventricular valves, and S2 is the closure of the semilunar valves. And if I hear a murmur, diastolic murmur is after S1, and systolic murmur is after S1, and a diastolic murmur is after S2. It's a mouthful. Okay. I'm gonna go ahead and listen to you.
Do I have a murmur? I really do. I did.
Okay. Oh, and then actually, I think I'm supposed to have you lay down for this part. I'm gonna have you lay down, and then I'm gonna listen again and listen with both
Just
sides.
like
I'm
this,
sorry.
that way?
Yeah, just that way is fine. Sorry.
Cool.
All right. So I'm actually gonna listen with the bell and the diaphragm of the stethoscope. Okay. And then, sorry, just stay there for me, and I'm gonna go ahead and palpate just to see if I feel any vibrations or thrills or anything like that. All right. Okay, and then I'm gonna feel your temporal and your carotid arteries, okay? My carotid one at a time. And then I'm gonna go ahead and listen to them as well. Sorry. Okay. And then you can sit back up if you want to for a second. And then I'm gonna feel the rest of his pulses. So I'm gonna have you straighten your arms out for me. The brachial, his radial pulses here. Sorry. I'm actually gonna, well, that's okay. I'm gonna feel his popliteal pulses right behind his knees. His posterior tibial, both sides. And then his dorsalis pedis pulses. Okay. Let's see. Okay. So I'm gonna actually, I know I keep moving you around. I'm gonna have you lay back down. I'm gonna inspect your belly. You got a pillow?
I'm alright.
Okay. So I'm looking at his skin, making sure there's no masses or anything like that. I'm gonna go ahead and listen to his belly in all 4 quadrants. Make sure I hear bowel sounds. Okay. And then I'm gonna lightly palpate your belly. Just let me know if you have any pain or anything.
Nope.
Okay. I'm gonna push a little deeper for deep palpation. Any pain?
No.
Okay. I'm gonna palpate his liver. Let me see. I gotta kind of go ahead and take a deep breath. Sorry, I'm not for sure. Okay, you're good. And then I'm gonna feel both of his kidneys. I'm gonna just grab right under here. You're good. Take a deep breath. Okay, and then let's do the same thing on this side. Good. Okay. And then you're getting that side, and I'm just gonna press and feel the aorta right over here. Okay. You can sit back up. It's the abdomen. Okay, let me think. Okay, so I'm gonna check all of your, not your strength. I'm gonna check your arms, so I'm gonna have you raise your arms all the way up.
Mm-hmm.
And like that, yep, and put them behind your head. I'm checking his shoulder You're good.
Okay.
You can put them straight back down, put them behind your back. Okay, that's good. And then can you bend your arms? And bend back. And then let's do the same thing with your hands. Can you?
Right.
Yep, that's good. And let's go up and yep. And okay, perfect. Straighten them out. And let's see. Straighten out your legs for me. Okay, and go back. And then, but that's okay. Can you lift your foot up, like just your foot? Okay, and then back down. And then the other side. Okay. I'm gonna have you lay back down again. Okay, I'm gonna have you bend one knee all the way up, like put your foot up on the bed.
Oh.
And put it like on top of this knee actually if you can, and then lean it this way. Okay, that's good, that's good. Yeah, and then I'm gonna have you bring it back up for 1 second, and then go ahead and push it down that way. Okay, that's good. And then can you do that with this side as well? Yep, and then go that way. Okay, and come back, and then set it right there, and then bring it down this way. Perfect. Okay. All right, sit back up for real now. All right, so I'm gonna put my hand here. Don't let me pull you. Okay, don't let me push you. Same thing on this side. Don't let me push you. Don't let me pull you. I'm gonna make sure that he has balance and he doesn't fall over. So I'm gonna give you a little nudge. Don't fall back. Okay, and then down here. Don't let me pull your leg. Don't let me push you.
Mm-hmm.
And then this side. Let me pull. Let me push. Alright, and then I'm going to try to do your feet. It's kind of hard because the bed's low, but okay. Go ahead and push down. Alright, and then don't let me push up. Perfect. And then this side. Alright, and then push up. Push up. Okay. Let me wash my hands and then I'll have you squeeze both my hands. Alright, go ahead and squeeze both my hands for me. Perfect. Let me think. Let me do this. Okay, so I'm gonna have you close your eye. Well, you can keep them open. So this is dull and this is sharp, okay?
Okay.
So I'm gonna have you close your eyes and just tell me if it's dull or sharp.
Okay. Dull. Sharp. Dull. Dull. Sharp. Dull.
Alright, I'm gonna do your legs too, okay?
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay. Check your reflexes. So I'm gonna.
Moving over there. Or?
Yeah. Thank you. Okay. So I'm gonna check the bicep. Just do a little tap. Alright, let's do this side. Alright, you gotta lift your arm like this and tense the tricep. Alright, and then we'll do this side. Okay, and then let's see your wrist here. Actually, hold on, go ahead and rest it for me and that might be easier. Okay, and then we'll do your knees. I don't want to hit this one too hard. There's another one, hold on. No, the Achilles tendon, so we're gonna do, I'm just gonna hold your foot here and then Okay, and then, alright, and then I'm gonna check your Babinski reflex on the bottom of your foot. So I'm just gonna start here and ticklish.
Yeah.
And then do the same thing on this side. Alright.
You have to do the.
Yeah. So, okay, so that was the reflexes. So let's, okay, yeah. I'm gonna have you close your eyes. I'm gonna write a number. Actually, before I do that, I forgot one hearing test. I'm just gonna do it real quick. It's called the whisper test. So I'm gonna have you cover that ear, and I'm gonna whisper a set of numbers in this ear. Just tell me what you hear.
1, 2, 3.
Okay, and then cover that ear.
4, 5, 6.
Okay, perfect. All right, so now I'm gonna have you close your eyes. I'm gonna write a number in your hand, and just tell me what the number is. Okay.
Okay. Do it again. 2.
Okay, and then let's do this side.
0.
Okay. And then I'm gonna have you keep your eyes closed. I have some random objects. I'm gonna put one in each hand, and you're just gonna tell me what it is. Okay.
Okay.
Okay. So we'll do this hand first. Go ahead and close your hand. You can feel around. Just tell me what you think it is.
It's a coin.
Okay. And then the other hand. There you go.
Key.
Yep. Okay. I'm gonna have you stand up, and then I'm gonna test his. Make sure you can bend forward. So go ahead and bend forward for me. Just,
I like that.
yeah,
Okay, gotcha.
yeah. Sorry. Okay, you can go back up, and then try to bend backwards a little bit. That's good. Sideways. Yep, that's good. And then while you're because you're standing, go ahead and just do your head sideways each way, and then forward and backwards. Let's see. Okay. Let's do the walking test. So what I'll have you do is I'll have you stand right over here.
Okay.
And just take a few regular steps forward that way. Okay. Turn around. You're gonna do like the drunk test, the tandem heel to toe. All right, and then you're gonna do the other way. We'll have you take a few steps on your tiptoes. And then go ahead and come back this way and a few steps on your heels. All right, that's good. You can go ahead and sit down. And then I'm gonna have you close or put your finger on your nose and just kind of go like this with both of them. Just, yep. And then close your eyes and do it as fast as you can. Okay, that's good. And then I'm gonna have you put your finger on your nose again, and you can keep your eyes open, and then go ahead and touch my finger with your finger, and then finger the nose over here, down here, and then one more time. Okay. And then since your hands are already right there, I'm gonna have you do the hand pat. So you'll just kind of flip them real quick and just do it as fast as you can. All right, looks good. Think if I missed anything here. All right, I think I'm gonna take a look at my thing and just see what I missed. Okay.
Do I stop this?
Mm-mm. Okay, we can do that. so I forgot to say that I would check the AP diameter and his chest expansion whenever he is breathing. And then I also forgot to just don't let me push your head back. Okay. I did the sternal nudge. And then also when I'm listening to his heart, if I have a difficult time hearing, I would either have him lean forward or lay in left lateral, so it would be easier. I think that's it. Yeah.